Our audit that we're going to present today is about SIP still section, which was firstly provided by the NHS and then adopted by the HSE and started to be as a practice in the NMH, the National Maternity Hospital, at 2022. So it basically focuses on the idea of the patients to be drinking water until they go into the section and to stop the prolonged fasting, specifically towards the water. It helps with the hemodynamic stability during the section and after the spinal, and also making the patients less nauseous during the surgery, and also obviously helps with the IV access. So the materials and methods that were used, the duration was 1 month and 8 days. The populations were the patients undergoing elective cesarean section. The sampling that we used was random sampling, and the method of sampling was the printed forms filled by the NCHDs. The presentation was by Excel sheets, and the data analysis was done by the SPSS. The audit results are, so firstly, the total number of patients were 53, 6 of them were inpatient, 47 of them were outpatients. The minimum time elapsed from the last step to call for the section was 5 minutes. The maximum time was 12 hours and 46 minutes, which is very long fasting. And the number of patients with last sip that was less than 1 hour was 37, which is almost 70% of patients. And the number of patients with the last sip that was more than equal to or more than 1 hour is 16, which is almost 30%. So our recommendations are to provide information sheets to patients at admission office, clearly mentioning its benefits, guiding them in obstetric OBD, improve compliance to provide information sheets to patients already provided in their ward and main wards, education of nurses and midwives for proper documentation, including scanning of SIP cards to patient notes, and also regarding the documentation is to add separate column for last water intake nursing pre-op, as this will help to improve the compliance. Online resources on National Maternity Hospital website for patient education. And thank you.